Australia, a land known for its extraordinary diversity, is home to one of the world's oldest living cultures, the Aboriginal and Torres Strait Islander peoples. Yet, a troubling health disparity exists within these communities. Greetings, my precious students. I am Olivia, and I welcome you all once again to Online Assignment Bank. As you already know that diabetes prevalence among Indigenous Australians is significantly higher than in non-Indigenous populations, signaling a crucial health concern that needs urgent attention. To address these disparities, a strategy was put in place, the National Aboriginal and Torres Strait Islander Health Plan, or NATS-IHP. This comprehensive approach aims to improve Indigenous health outcomes and reduce the diabetes incidence. So, let's begin our exploration. Established with the intent to bridge health disparities, the NATS-IHP has become an integral part of Indigenous healthcare. But the question we need to ponder on is, how much impact has it had on combating diabetes within this community? We see significant efforts in diabetes management, from health checkups to screening programs. But how effective have these been? Evidence shows successes, but also points out areas where we've yet to make substantial progress. Significant measures have been taken, from regular health checkups to comprehensive diabetes screenings. However, the effectiveness of these strategies remains under scrutiny. While some areas show promising improvements, others highlight the need for deeper intervention and more comprehensive strategies. To augment the effectiveness of NATS-IHP, experts recommend strengthening programs like the Indigenous Advancement Strategy and incorporating the model of chronic disease care, as these recommendations not only bolster existing efforts, but also introduce new avenues to mitigate the diabetes crisis within Indigenous communities. Now that we've explored the historical context of diabetes and the potential impact of NATS-IHP on Indigenous Australians, let's delve into how we can transform this topic into a critically evaluated essay for university students, as this approach will ensure they effectively comprehend the subject matter and garner high academic scores. To explore this complex issue, we've tapped into a rich trove of resources, focusing on culturally appropriate healthcare, academic journals, and databases. These resources shine a light on Indigenous Australian health, particularly in relation to diabetes. Moving on, our guiding keywords include 1. Aboriginal health. 2. Torres Strait Islander health. 3. Diabetes. 4. NATS-IHP. 5. Non-communicable diseases. 6. Chronic disease. And 7. Health disparities. Each of these terms provided a unique angle to investigate the issue at hand. Also, prominent journals we referred to include Diabetes Research and Clinical Practice, BMC Public Health, Australian Journal of Primary Health, and many more. Online databases like PubMed, SciNaHL, Scopus, Google Scholar, and Australian Indigenous Health Infonet were valuable tools in our research. Next, we have 7 key section divisions, each examining a distinct aspect of the issue. Starting with an introduction, we then delve into the description of NATS-IHP, its role, a critical analysis, and recommendations. After that, we conclude with a look at the role of professional practice and a summary of our findings. After that, the investigation is presented in an academic format, complete with a cover sheet, footers on each page, and APA 7 style referencing. The text is double-spaced, using a clear, readable font like Times New Roman or Arial, with a 2 cm margin on all sides. With these strategies, we aim to provide university students with a roadmap to critically analyze this issue and generate insightful, well-structured essays that earn them high academic marks. As healthcare providers, the call for culturally safe practices becomes imperative. Only through understanding and respecting cultural nuances, we can make a significant impact. So, we have reached towards the end of our session. Always remember that the fight against diabetes among Indigenous Australians is more than just a health issue. It's a battle for justice, equality, and the realization of human rights. Let's take each step to bring a healthier future for all Australians, and together let's strive for health equity. Until the next time, toodles.